Welcome back. It is often referred to as the heroin epidemic, but synthetic analogs of heroin are causing a deadly spike in fatal overdoses. So what are those analogs that are allegedly coming through the mail? Fentanyl is a painkiller prescribed for terminally ill cancer patients. It's up to 100 times more potent than morphine. Carfentanil is even more deadly. It is an elephant tranquilizer, and it's 10,000 times more potent than morphine. As little as 2 milligrams can be lethal. Law enforcement even uses gloves to handle it. Last year, the majority of overdose deaths in Sarasota and Manatee County are from opioids, and they were actually caused by carfentanil and not heroin. How do we keep these drugs off the Suncoast? And joining us for more is PJ Brooks, Vice President of Outpatient and Youth Services at First Step Addiction Recovery, and Assistant Special Agent James DiCaprio. He is in charge of the DEA office in Tampa. Gentlemen, thank you so much for joining us. There was something interesting in Ray's story where the drug counselor was saying, you know, if you heard that there's a deadly batch of alcohol down the street, you wouldn't drink it. But you hear there's a deadly batch of fentanyl or carfentanil down the street and you rush to it. Why is that?
You know, here's an analogy, and this is for many of us who've been around a long time, and I've been in the field 29 years. First we had cocaine back in the early 80s, and then all of a sudden we had a derivative, crack cocaine. It's a much more intense high, cheaper to make, and shorter acting. And it really decimated whole communities because of the nature of that drug. Well, we have heroin, and then now we have the fentanyls, which are a much more intense, shorter acting high, and it's comparable behavior to what was going on with the crack cocaine epidemic. But unfortunately, in this situation, many individuals are dying. I mean, people did die from crack cocaine, but not near to the extent of what we're seeing now.
And Agent DiCaprio, fentanyl has a use, as Ray said in his story, in terms of pain management for terminal cancer patients. But carfentanil, I mean, that's a totally different animal, literally. I mean, is there any legal usage for that in the United States, and it has basically been hijacked?
They've been using that for large animals to put them down. The problem right now is what the users don't realize is when you're using carfentanil, you're literally looking for death. That's what's going to happen, because these dealers now, they're not experienced as far as how to mix these things. So when these users are going for that high, and to answer, you know, to talk about what PJ said, they're chasing the best high, the ones that can bring them closest to death. The problem is when you're mixing carfentanil, or if you're even taking that straight, that will kill you. And you know, some of these programs where they have Narcan that's going to help revive you, that may not work. And for the dealers that are out there, if you kill somebody, it leads to an overdose and kill somebody, you're going to be charged as such. So it's a game changer. Right, and I know the Florida legislature is actually working on a bill that deals with that. But when you explain this, what component parts does it come into our area? And I mean, is this a mixed compound that people get, or does it come into you know, the area in terms of ingredients which somebody has to mix together? It's coming in as carfentanil, and it's being mixed with other drugs or cutting agents. So, like I said, these guys who are mixing it, they don't really know how to mix it. They're just trying to make it just strong enough where it's going to draw people to use it, these users, to make it appealing to the users, to get that high.
And PJ, just for people to know, is there a difference in terms of trying to treat somebody who is hooked on heroin and somebody who is hooked on fentanyl or carfentanil in terms of how you approach this and your possible success in terms of treating people?
Well, really the comparison it's chasing an opiate. You know, these individuals, whether it be heroin or fentanyl or a combination of, and that's often the case, it's the desire to get high from the opiate. But in many respects, it's not just, I'm not just trying to get high, I'm trying to avoid being dope sick. You know, I'm trying to go through the withdrawal experience, and unfortunately, because with the fentanyls, they don't last as long, so they're having to use it more and more often versus the other opiates, and so they're dealing with that potential dope sickness from the withdrawal probably on a much more regular basis.
All right, we are just getting started, and we'll pick up our discussion right after we check on our weather. Welcome back. If you're just joining us, we are discussing synthetic opioids such as fentanyl and carfentanil. Congressman Vern Buchanan says these drugs may be coming to the Suncoast through the U.S. mail, and he is co-sponsoring legislation to crack down on this type of trafficking. Our guests tonight are P.J. Brooks of First Step Addiction Recovery and Assistant Special Agent James DiCaprio of the DEA Tampa District Office. This is not just Sarasota and Manatee County, which are dealing with this issue. I mean, I have a story here about how bad the situation is in places like Ohio and actually where the city where I met my wife and you went to college, Springfield, Massachusetts. This is a problem all over the country. And let's talk specifically about how this is coming into the country. The subject of our story is that in many cases it's coming from China. Agent DiCaprio, how?
They're shipping it in packages. People are ordering it on the dark web, and you have all these people that are just sending it into the U.S. through the mail, and also diverting it into other countries like Canada, Mexico, and then driving it across. And the problem is that you don't need a lot of this. You don't need to ship tons of it, like cocaine or marijuana. It's small quantities, gram, ounce, small kilo quantities, so you can, it's very hard to detect.
And PJ, you were saying there's a huge difference between what was legally used in terms of carfentanil every year in the United States as opposed to how it's used illegally.
Yeah, we're dealing with this epidemic, and if you look at the veterinary community in terms of the amount of carfentanil needed nationally to deal with the number of animals to be put down was only 18 grams.
You know, in Ray's story, Congressman Buchanan talked about that, companies like FedEx and other private shippers have done a pretty good job in terms of monitoring, their packaging going through the mail. What's the difference between a company like FedEx and the U.S. Postal Service in terms of monitoring or screening what's in the mail?
I think the smaller companies, FedEx, UPS, it's a little bit easier, a little bit better oversight because they're smaller operations. But the U.S. Post Office is massive. It's huge. Everybody is getting U.S. mail. Not everybody's getting FedEx or UPS packages.
Now, first you said that it's being ordered. You could find places to get this on the dark web. How easy is it if you were just sitting here in Sarasota to order carfentanil tonight?
Pretty easy. I mean, you get onto some of these web browsers and you can order it and have it shipped to you.
Right. The legislation we're talking about, the STOP Act, which would add surveillance to the mail, how would it work, do you think, and how effective do you think it would be?
I think anything would be effective. Nothing, something is better than nothing. So, but I think not only will you have people that are held responsible that are sending it and have to claim what's inside and state what's inside and what the use is, so that helps. And then all of a sudden it kind of leaves a fingerprint on the package so that when you're sending in, somebody can take a look and see what it, now you can trace it back to somebody, and now they have to say what is actually inside, and it helps if it's not what they say inside, then we go backwards. We've worked with China on making things illegal, and they've been very, very good with us, trying to help us out, including themselves. They see the dangers.
What's the problem with China cracking down on the exportation of it?
They keep changing. The manufacturers keep changing. They're out to make the almighty dollar. They're not putting a value on human life because obviously they see how it's destroying all the lives here in the U.S. These manufacturers are changing a molecule, the chemical makeup. So they're they're staying one step ahead of the law. So China goes in, changes the law, bans carfentanil, then all of a sudden they change the molecule, they come up with a different type.
PJ, just another factoid about this carfentanil used by Russian special forces for assassination attempts. I mean, that's just how potent this stuff is. And, law enforcement, I would imagine there's only one part of the issue here. What needs to be done here locally and elsewhere that's not being done right now?
You know, we need to take it to another level in terms of access to care and really looking at the treatment needs and the issues around connecting with the treatment population. These folks that are in need of treatment, we need to make sure that if they need it, they get it. And not everybody is.
Right, and we talked last week, there is not enough resources for you and other places in terms of all the people who need it.
And really, we're dealing with the now. We also got to think about what's going to happen in the future. And when we talk about that, we really need to ramp up our efforts around prevention, youth education, youth intervention. I always say that adolescent treatment is adult prevention, because if we're able to get to them before they're adults and having children, we may be able to intervene in a generation and do things like that.
And I would imagine, Agent DiCaprio, that trying to interdict carfentanil coming into the country is a little bit different than, let's say, cocaine or marijuana or actually pure heroin, because those things are illegal anywhere you go. I would imagine, just playing devil's advocate for a second, there may be privacy people out there who would get nervous in terms of the stricter monitoring of U.S. mail. Is that the pushback?
I would say that'd be the first thing that comes to mind when someone is getting a package and it says on the outside what it is. I think the privacy laws, people will be affected. But it's really hard to, as far as talking about resources, to go after something like this from a law enforcement and from a health standpoint when people are using something and chasing something that's going to kill them. It's kind of hard to grasp and understand that. And we do have to get it from every angle, from education, law enforcement, laws, penalties for people. And it's really, really hard when people are trying to devalue and self-destruct.
And when you're talking about the screening for these things, are you talking about algorithms based upon the information on the package itself? Because unlike whether it's marijuana or heroin or cocaine, you can't have a dog out there sniffing these packages, or unless, correct me if I'm wrong, can a trained dog sniff this stuff out in packages?
Well, no, it's dangerous for dogs, it's dangerous for law enforcement, and that's why I said it. This is, not only do you have the dangers, the challenge of catching these criminals and bad guys and drug dealers, now when you come up on these guys, not only are you worried about a gun or trying to make sure preserve your own life and safeties as far as any kind of weapons inside. Now the drug that you're looking at has become a weapon, and it's dangerous for law enforcement and the dogs.
PJ, where do you see this going? Because we have one story how the coroner does not have enough room to store the bodies here locally. We have stories that Narcan, the dosage, we talked about this last week, it's not always effective the first time you use it. Do you see this getting even worse before it gets better?
We are in a public health crisis. We truly are. This meets the total criteria for an epidemic in a way that is probably as challenging as any major pandemic that has come about. And I think until we totally commit to working on this on all fronts, not just the interdiction on the supply side, but also looking at the demand side and looking at providing all those care, we're going to be really struggling.
All right, let's take a quick break, and when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about President Trump's first 100 days in office. Welcome back. Could increased monitoring of the Postal Service help keep opioids out of the Suncoast? Well, users and dealers find another way to get these drugs. Our guests join us right now for final thoughts. And PJ, that's the question to you. If monitoring the mail is effective as we would hope it to be, are people just going to get this in another way?
The addiction is going to, individuals with an addictive disorder will find whatever drug they can use. We saw this with the prescription drug epidemic, and it shifted to heroin when prescription drugs weren't available, and it will be something else. If we don't look at the disease itself and work on it, it's going to be a broken record.
Agent DiCaprio, we were talking about the crack cocaine epidemic, which was big in the 80s and the 90s. I know crack is still out there, but we basically did turn the corner on it. I mean, is it a matter of stricter sentencing of this, or is monitoring the mail for it to come in from overseas just one part of a very big puzzle?
I think you have to hit it from every angle. I don't think one thing is the cure. Definitely the stricter sentences in the crack epidemic. I worked in New York City in 1988, and those sentences, those drug dealers knew when we came. They were afraid, and they knew, and I think that helped tremendously as a weapon for law enforcement to deter people from selling that.
Right.
All of a sudden, on the other end is education. You have to educate people to know that you just don't have to take a pill to take care of pain.
Right, and let me ask you this, because the problem with the crack epidemic is that there was a dichotomy between crack and powder cocaine in terms of sentencing. In terms of the people who are having this problem with fentanyl and carfentanil right now, does it span the socioeconomics of our country?
It's everybody, because a lot of these people got there from prescription pills and abuse of prescription pills. So now they're a lot of these are the consumers of fentanyl and carfentanil. So now it's everybody. You can't just focus in one area or another area or certain individuals. It's everybody.
All right, we'll have to leave it there, gentlemen. Thank you very much. But before we go, we want to share with you what some of our viewers are saying about Friday's topic, President Trump's first 100 days in office. His approval rating is hovering around 40%, the lowest of any president at this point. While he was able to confirm his Supreme Court pick, he has faced difficulty with Congress and the courts, and we asked you what you thought of his first 100 days. Michelle McGrath writes, "Keep up the good work, my president. It will take time, especially since there is so much opposition. I pray that the people will continue to show these politicians who's in charge by voting. Make America great again." Richard Torrado writes, "Historically bad, has both the House and the Senate in his pocket that still can't get anything accomplished correctly, pandered to the frightened and the weak of character, and has done nothing to prove he didn't come straight from their ranks. A national embarrassment, even for a reality TV personality." Wow. And Mike Conkey writes, "It seems like the only reason anyone likes him is because he is not Hillary, but ask yourself, do you really like him for his own accomplishments or just because he is the lesser of two evils?" What do you think about opioids coming to our community by mail? Join the conversation on our Facebook page, facebook.com/news@7. And FYI, want to watch past Roundtable discussions? They're available on Apple TV, Amazon Fire, and Roku. Thanks to both our guests for being here tonight. PJ Brooks is Vice President of Outreach and Youth Services at First Step Addiction Recovery and Assistant Special Agent in charge of the Tampa DEA office. Agent DiCaprio, thank you very much for joining us.